Types of the intracranial hemorrhage. So firstly, looking at the extradural hemorrhage or the epidural hematoma, in short EDH. The source here is the MMA, that is the middle meningeal artery. So the cause being the trauma fracture of the squamous part of the temporal base, as well as there is the lens or the lentiform shaped opacity. There's presence of a lucid interval, and the treatment is by the surgical evacuation of the large and rapidly evolving EDH. Next, we are looking at the acute subdural hemorrhage. So the source here is the venous bridging veins, and the cause is the trauma. The most common being the old age, alcoholism, and patients on the anticoagulant, as well as a shaken baby syndrome. So the form of child abuse in case of infants and the toddlers. Clinical features involve in case of acute SDH and the chronic SDH. Acute SDH involves the lucid interval, whereas the chronic SDH, it involves the drowsiness and the headache. Then looking at the CT, it involves the crescent shape which is seen. And now looking at the treatment, it resolves spontaneously, as well as there can be surgical drainage which can be performed. Next, we move on to the acute on the chronic SDH. So here the source being the venous bridging veins. The cause here is the trauma in old age, as well as in patients on anticoagulants. Then there is a presence of crescent clots. There's history of headache, confusion, and in case of they are prone to falls. Next, we're looking at subarachnoid hemorrhage. So the source here is the arterial, and the cause being the trauma being the most common. Next, we have the perianeurysm, the most common being the terminal ICA and MCA bifurcation. There is, as well as in the top of the basilar artery. The clinical features, there is a characteristic thunderclap headache, and CSF shows the xanthochromia. There is presence of the hyperdensity in the subarachnoid space, and treatment is by the triple H therapy, that is treating the hypertension, hypovolemia, and the hemodilution. Next is to prevent the vasopressin and the coiling of the perianeurysm. Then we look at the intraparenchymal hemorrhage. So the most common being the intracranial hemorrhage, most common intracranial hemorrhage, and the cause is hypertension. There is hyperdensity with the brain parenchyma, and the site being the putamen of the basal ganglia. This is the most common. Treatment is by the correction of any identical coagulopathy by infusing prothrombin complex concentrates, FFP, fresh platelets as required, and the surgical evaluation for the cerebellar hematoma, that is in case of greater than 3 cm in size.